Good morning, everyone, and welcome to my collaboration and leadership reflection video for NURS 4010, Leading People, Processes, and Organizations in Interprofessional Practice. My name is Deshore Natella. During this video, I plan to reflect on an interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes. Identify how poor collaboration can result in inefficient management of human and financial resources. Identify best practice leadership strategies from the literature that would improve an interdisciplinary team's ability to achieve its goals. Identify best practice interdisciplinary collaboration strategies to help a team achieve its goals and work together. The experience that I will share with you tells a story of how I was tasked with orchestrating the transference of the stable patients from my unit, the adult psychiatric unit, which I will refer to as APS, to the facility's clinical unit. I will also refer to the mental health technicians as MHTs. Although I am a shift nurse that works on the floor with other nurses, I am also a per diem supervisor. A per diem supervisor is a fill-in for when a full-time house supervisor is not able to supervise a shift. I work in Florida's largest Baker Act receiving facility. A Baker Act is when the patient is involuntarily admitted to a psychiatric facility for evaluation for 72 hours. I work on the Adult Psychiatric Services Unit, also known as APS. APS houses the more psychotic patients as well as patients that suffer from major depression. This unit carries the largest census within the facility. Whenever a qualifying Baker Act comes in, our facility must admit them. Often, APS is at capacity, requiring the more stable patients to be transferred to a more stable unit. On this day, I was tasked with transferring 6 of the more stable patients from APS to the more stable unit within the facility. The director of nursing advised the house supervisor that there would be many admissions arriving to the hospital that night, and there were also some admissions left over from the day shift. Considering that APS is the primary adult unit in the hospital, it is required that all new adult admissions be admitted to APS for stabilization and before they can be transferred to any other unit. Although the task was assigned to me, I realized that I would need to collaborate with the unit stakeholders, which are the MHTs, the other nurses, as well as the patients, to determine who would be appropriate for the transfer. The objective was to identify the 6 most stable patients and have them transferred to a more stable unit so that the new admissions could be admitted to APS. This published evidence would support my idea. Quoting from a 2017 publication, Our Role Perceptions of Residents and Nurses Translated into Action. In the field of healthcare, interprofessional collaboration, which refers to health professionals from different occupational groups working together to care for patients, has become increasingly important in the past decades. End quote. I will now go step by step through the Plan, Do, Study, Act process. I will refer to it as PDSA. I will begin with the planning phase. I met with the nurses and MHTs that I was working with on the unit that night. I explained to them that we were going to get a high number of admissions for the night and we needed to transfer 6 stable patients to make room. One of the MHTs asked, "Why are we transferring patients in the middle of the night? Why can't admissions admit the incoming patients to the unit the 6 patients are supposed to be transferred to?" I explained that the incoming patients were to be admitted to APS for stabilization before they could be moved to a more stable unit. Since the MHTs spent more time face-to-face with the patients, I consulted with them to determine which patients were appropriate for the transfer. Being that the patients were under the care of the nurses, as they suggested patients, the MHTs were providing feedback. For example, I suggested transferring my patient by the name of Bob. The MHT stated that although Bob is generally a calm person, he is easily triggered. According to Straub C. et al. 2020, this is considered as interprofessional collaboration, the interaction of healthcare professionals with the patients and their families, as well as the collaboration of different healthcare professionals, are crucial for patient care. That night, there were 46 patients and 4 nurses. Therefore, there were 2 nurses with 12 patients and 2 nurses with 11 patients. I decided that I would have the nurses with 12 patients transfer 2 of their patients and have the nurses with 11 patients transfer 1 of their patients. This in turn would leave each nurse with 10 patients, making the workload equal. Also, once it was determined which patients were to be transferred, I explained to the patients the reason for the transfer and asked them how they felt about it. As described by Rohrer Blay, C., 2018, this is autonomy, to respect the patient's right to self-determination. Each patient was stable and wanted to be in a quieter environment. Therefore, they were accepting of the transfer, as were the nurses and the MHTs. Now let's move on to the do phase. Once the final 6 were picked, the nurses took the vital signs of the patients, filled out the transfer sheet listing what medications they took within the last 4 hours, their vital signs, and the reason for the transfer. However, before transferring each patient, the final step was to call the receiving unit's nurse to advise of the transfer and to give a report on each patient. Now the study phase. After completing the plan and do phases of the cycle, I reported back to the supervisor to report the name of the 6 patients that were transferred. Also, during the conversation, it was mentioned by one of the nurses how important it was that the MHTs were included, considering they spend more time face-to-face with the patients. Lastly, let's conclude with the act phase. The stakeholders learned when transferring a patient, it is important to get the feedback of the MHT, considering they work face-to-face with the patients. Autonomy is important even in something as small as transferring a patient. A change in environment could easily trigger a patient and cause regression. It is important to collaborate to make the transition smooth for both the patients and the staff. Planning and implementing the transference of each patient was the perfect opportunity to utilize interprofessional collaboration. The process was smooth because of the involvement and cooperation of each stakeholder. A lack of collaboration could have resulted in a more difficult process, a likely unfavorable outcome, and maybe even harm to the patients. This is supported by a quote from Methods to Incorporating Stakeholder Engagement into Clinical Trial Design, 2017. Lack of engagement with healthcare stakeholders results in missed opportunities to understand translation of evidence into practice, end quote. In conclusion, I am always grateful for leadership opportunities. Although the task seems simple, I know that it would not have been as smooth without collaborating with the nurses, MHTs, and the patients. After completing the task, I breathed a sigh of relief and felt a little more confident in knowing that I am able to effectively collaborate with others to accomplish a desired outcome. Thank you.